Welcome. Welcome, my dear friends. Myself, Professor Dr. Rajendra Deshpande, would like to welcome you all in my Ayurveda Academy YouTube channel. Myself, Professor Deshpande, is MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For paid online consultation or paid online Ayurveda classes, you can WhatsApp me on 92268106330. Today's video is regarding the Chancroid. Chancroid is also another venereal disease. My dear friends, I am making these 4, 5, 6 videos regarding the venereal diseases because nowadays the medias are exploiting the sexual the activities, and that's why the youngsters are getting trapped into the visiting to the prostitutes and the girlfriends, and they are getting these problems of venereal diseases. I have already uploaded the video of syphilis and gonorrhea, and now this is the next video of the venereal disease, which is called as a chancroid. So let us discuss about what is exactly the chancroid. Chancroid, the patient, that youngster or any adult person will complain that there are few small red papules or pustules, a very single growth, that is papule, but when there is a pus, that is called as a pustule. So there may be papule, there may be pustule with pus appears on genitalia. It may be the vulva in the females, or it may be the penis in the males, and also on the surrounding skin. Within few days, that particular papule or pustule gets converted to the necrotic ulcer. So in chancroid, there will be definitely ulcer on genitalia, either in the on the penis or on the in the female's vulva. Okay. So chancroid or chancre sore, that we have to differentiate. So here you can see the in the chancroid there is a soft ragged edge and also the pus is there. But in chancre sore, that is a hard raised edge. This is the difference in syphilis and the syphilitic ulcer and the chancroid ulcer. Okay. So chancroid flower contains, the ulcer flower contains yellowish slough from the auto inoculation. Auto inoculation slough will be there. Multiple ulcers are developed, which are also known as satellite ulcers. One central, and around that there will be again small ulcers. So those ulcers are called as a satellite ulcers. Ulcers, all these ulcers, small ulcers, are definitely painful, and local inguinal lymph nodes are sometimes enlarged and sometimes not. It is not mandatory. It is not mandatory. You have to check the inguinal region whether there is a lymph gland enlargement, but basically ulcers are multiple and ulcers are painful. Okay, and sometimes this particular lymph node enlargement can get pus, that is called as a suppuration process. Okay, let us see the difference in chancroid versus syphilis. In chancroid, soft chancre is there. In the syphilis, hard chancre is there. Chancre is like an ulcer. Soft chancre is mildly indurated, but this is induration is more firm in the syphilis. Will be the redness, strong erythema in the chancroid, but mild erythema in the syphilis. Chancroid ulcers are very painful, whether superinfected or not. Whether it is infection, superadded infection or not, that is not a problem. They are always painful. But in syphilis, usually the ulcer is painless. Without any pain, the patient forget about that ulcer and then create the secondary and tertiary syphilis. But of course, this syphilitic ulcer can become painful when there will be secondary infection. You understand? Here, whether there is an infection or not, nothing. Chancroid ulcers will be always painful. Syphilitic ulcers to begin with, no pain. But if there is superadded infection, then only it can start paining. Okay. So chancroid diagnosis by direct microscopic examination, gram stain will be done. Here also by direct microscopic examination, dark field will be observed. Okay. Sore on the penis. Now again the revision type of the slide. When there are ulcers on the penis, what type of the diseases they are? Number 1, chancroid. Number 2, granuloma inguinal. And number 3, lymphogranuloma venerum. Okay, all in 3 cases, there will be ulcers, a little bit difference. In sore on the penis, for example, chancroid, multiple, this word is very important, painful ulcers with slough. This is the explanation of chancroid. Then granuloma inguinal, beefy red ulcer, very hot red with satellite nodules. Satellite nodules. And here in lymphogranuloma venerum, inguinal bubo with healed or active ulcer. Ulcer may be already healed or it may be active ulcer, but the most important feature is lymph node enlargement in the inguinal region, which is called as a bubo. Don't forget this word bubo. Okay. Now, for all these ulcer cases, you have the common treatment, like for example, antibiotic tablet norfloxacin, 400 milligram 2 times in a day for 10 days. For the normal infection, urinary tract, etc., we stopped on the 5th or 7th day. But for venereal diseases, the treatment should be given minimum for 10 days. Then if Norflox, if the patient is sensitive or if you want another trial, then tablet ciprofloxacin 500 milligram BD for 10 days. Now, this is the last is an old traditional drug which is not used many of the doctors today, but tablet erythromycin 500 milligram, but QID. Here the dose is only 2 times, but here 8 a.m., 12 noon, 4 p.m. and 8 p.m. So the dose is more frequently given. So nowadays nobody is using the erythromycin. Mostly Norflox and Ciplox are used. Now locally wash and apply. Cleanliness, hygiene is very important. Terramycin or soframycin ointment. Treat both the partner, husband and wife, that is most important, and do HIV test for all patients with venereal diseases. This is very important instruction for the doctors. So my dear friends, although I have mentioned Norflox, Ciplox, etc., this is only educational video. Self-medication should not be done. वैधानिक इशारा, disclaimer, कौन सी भी बीमारी में यथावश्यक यथाकाल वैद्यकीय सलाह लेना जरूरत है. If you are suffering from cerebral palsy, arthritis, motor neuron disease, cancer, attention deficit, hyperactive children, idiopathic thrombocytopenic purpura, or any such type of chronic or autoimmune diseases, you can definitely contact Ayurveda Academy, which has a team of doctors with different expertise, and we are available on 9226810630 by WhatsApp only. Okay, so I request you like this video, like thumbs up, share this video, and please don't forget to subscribe my YouTube channel, Ayurveda Academy, and don't forget to press the bell button icon to get the intimation of newly uploaded videos. I wish all the best and take care and bye-bye.